Does American politician Joe Biden have dementia? I'm a geriatrician, and here's my take. If you haven't watched before, my name is Dr. Nicole Didick. I'm a geriatrician and internist, so I'm board certified in both of those specialties, and I'm a doctor who specializes in the care of older adults. I've been seeing a lot of speculation in the news about the mental fitness and physical fitness of Joe Biden to be president. There's some speculation about Donald Trump as well. But a lot of this stuff, the cognitive speculation, is more around Mr. Biden. So Joe Biden is the Democratic nominee for the presidential election that's coming up in November of 2020. But what I've seen is people sort of making comments about his language skills, that he sometimes seems confused or disoriented, that he's repetitive, and that they've also been asking him if he's taken any cognitive screening tests. Sometimes he has said that he has taken some cognitive tests. I've seen other pieces where he says that he doesn't have to take those tests and that they're ridiculous. So he hasn't really released his scores on that. But there's definitely a lot of talk about that. And a lot of what comes up is his age, how, it would be historic that if he were to become president, he would be the oldest first-term president. So a lot of the discussion, it doesn't take very long when people are talking about his health to bring his age into the picture. So when I hear that kind of discussion, I think about, well, what's the evidence that he might have a health issue or a cognitive issue or other mental health challenge? And how could you try to figure this out? How, the speculation that the media is doing, is that really reasonable? Is that likely to give you information that's going to allow you to draw a conclusion about his health? And whether it's really a good thing to speculate about that, whether it's fair to even do that. Now, I don't know Mr. Biden. I've never met him, and so I can't give an opinion on his health at all. I certainly can't give a medical opinion. But this is just sort of a review of what I've observed and what has been commented on in the media. Okay, so let's dive in. So when people mention Joe Biden and they start talking about his cognitive changes, they will mention that he sometimes seems disoriented. Now, could these be the signs of someone who is living with dementia? Well, what are the signs of dementia? So oftentimes they are signs that are more easily observed by others rather than the person themselves. So oftentimes when people get dementia, the person with dementia doesn't really notice the cognitive changes, but others might notice it. So they might notice things like changes in short-term memory. And remember that dementia is kind of an umbrella term. There are many different types of dementia, but Alzheimer's is the most common cause of dementia. Alzheimer's is a disease. And it causes plaques and tangles in the brain, affecting short-term memory and other cognitive skills. So when I talk about dementia and their symptoms, I'm really talking about the symptoms of Alzheimer's, although these symptoms can be seen in other types of dementia as well. So what are some of the signs that a person is developing dementia? Well, you might notice changes in short-term memory. So this could show up as somebody being repetitive, forgetting that they've told you a story 10 minutes ago and telling it to you again. Or it might look like forgetting where an object has been placed, forgetting an appointment, or forgetting the name of a person. It could show up in changes with language. So that could involve finding a person's words, maybe stumbling a little bit in conversation or talking around something, like describing something instead of saying the word. So saying that, screen thing that you can type into instead of saying a tablet, that might be what you would notice the person doing. You might see somebody having more difficulty with complex tasks, so changes in executive function. That might involve things like balancing a checkbook or doing your taxes, figuring out how to pay bills and executing on that, or cooking, doing something like that. So it really depends on what the person was doing before and how those executive function tasks have changed. A person might have more difficulty with managing concepts of time. So a person might have more trouble remembering what month it is or where they are exactly. Not just like forgetting what day it is when you've had a vacation or a long weekend, but on a more consistent basis, being disoriented to things like that. There could also be changes in ability to concentrate. So maybe somebody who used to be able to read for hours at a time, after 10 minutes, they're continually losing their thread and have to put the book down. Same thing with watching a movie or television, just sort of not being able to stick with it and follow something the way that a person used to. There can also be changes in a person's visual spatial skills. So that's what we kind of test sometimes using the clock, right? But that's to really see how people can conceptualize things in space and kind of navigate their visual spatial skills. So that might show up as somebody having more trouble while drawing a clock or doing other activities similar to that. Somebody might have more trouble just doing something in general. So figuring out how to fill a pill dosette or how to arrange food on a plate or something like that, just kind of doing things incorrectly because of challenges with visual-spatial skill. When people are developing dementia, there are very often changes in personality and mood. So somebody could become more socially withdrawn, maybe more irritable, and depression is quite common early on or really at any stage in dementia. Now, note that I'm talking about changes, and that has to be the case to make a diagnosis of dementia. It has to be that these skills have changed relative to where they were before. If somebody has never been very good with names, then if they're 80 years old and not good with names, that doesn't necessarily mean that that's a sign of dementia. It might be the way that it's always been. So there has to be a change from a previous level of function. There also can't be some other explanation for why somebody is showing cognitive changes. So, for example, if somebody is exhausted physically or emotionally, their memory performance isn't going to be as good as it would be when they're well rested. Medications can affect brain performance. So can things like alcohol and cannabis and illicit drugs. I mentioned depression before, and if somebody is going through a major depression or some other major mental health challenge, they could very well look like they're having cognitive impairment due to dementia, but it's because of this other cause. And delirium is a sudden reversible change in thinking. A lot of people get this mixed up with dementia, but delirium comes on suddenly, and it's because of some underlying medical problem. So if somebody has a delirium, they could look like they have dementia, but it would be very different in some other important ways. How do we make a diagnosis of dementia? Well, we have to do more than just watch a few videos about somebody at a public speaking engagement. Dementia has to be diagnosed by a health professional. So oftentimes it's a geriatrician like myself, but it could be a psychiatrist, a neurologist, a family doctor, or somebody else. To make a diagnosis of dementia, we have to take a careful history. So we have to find out what changes are being observed and what the person's function and cognition was like before. We usually have to take information from the person themselves, as well as some reliable informant in their lives, like their partner or their kids or close friends, or coworkers if they're still at work. We do a thorough physical examination, including a neurological exam, looking for other signs that there could be something wrong with the brain. We do blood tests to make sure that there isn't some other problem in the blood chemistry or something else that could be causing the picture that we're seeing. We usually start with some basic blood work like a complete blood count, blood glucose, thyroid function tests, vitamin B12, calcium level, and so on. And oftentimes we do imaging, not always, but very often we'll do a CT scan or MRI of the head to make sure that there isn't something related to the brain that could explain this. So we'd be looking for things like a stroke, a tumor, bleeding, something like that. Now, going back to Joe Biden, he did have a bleeding aneurysm in 1988, which was repaired. So there could be some long-standing changes related to either that bleed or the surgery that might have affected his brain in kind of a permanent way. It could also be, though, that there's been some neuroplasticity in the ensuing few years. So he may have regained some of those changes, if there were some, at the time of that surgery. I don't know the details of that, so this is just all complete speculation. But that's the kind of thing that we would take into account when we're doing an evaluation for dementia. Now, there's a lot of talk about the dementia tests, and you may have heard of the MoCA, or Montreal Cognitive Assessment. That is a screening test, so it doesn't diagnose dementia. A person is much less likely to have dementia if their score on that test is 26 or more out of 30. If someone scores below 26, it doesn't mean they have dementia. It could mean that they have a category of change called mild cognitive impairment, which could be the early stages of dementia, but it might not be. It might be that someone will just remain at that mild cognitive impairment level for the rest of their life. It could mean that someone has dementia, but the test by itself does not necessarily give us a diagnosis. And I think that's important as well, because it seems like in the media, people want to know the score of this test so that they can judge whether or not it means somebody has dementia. But that's not what that test was designed for, and that's not how it should be used. I've met people who have very good normal range scores on the MoCA who actually are living with dementia. And I've met people with very low scores who are not living with dementia. So in inexpert hands, that number alone and that test alone is less meaningful. And so I don't think we should focus on that. And it's interesting that that is a focus in the media. I guess people like numbers, and they like to sort of be able to have some data to try to figure out whether someone has dementia or not. That's one of the difficult things about dementia and brain disorders and mental health disorders in general. So much of the diagnosis is based on observations of behavior and the history of what's been going on. It would be great if we could do a blood test or some kind of a paper test and get the diagnosis. But there aren't actually that many things like that in medicine, and dementia is no exception. So, does Joe Biden have dementia? I can't say for sure, and I don't think anybody else can either. We don't have enough information, at least what's been presented to us, about his previous level of function and cognition and how that might have changed. And just pulling out a few snippets of observations is probably, it might point to something going on with cognitive performance, but it's a long way from showing that somebody is living with dementia. There could be other factors that are affecting his performance, and it's impossible to make a diagnosis without an in-depth evaluation. Do I think it's right for there to be speculation about his mental abilities? Well, I guess anything's fair in an election, and probably most of the speculation is being done by people who would prefer that Joe Biden not win the presidential election. So there's definitely a bias there in having that discussion, right? So having that discussion and kind of promoting it could favor one side over the other. And that's true of people who talk about Donald Trump's health also, right? I think there's an undercurrent of ageism, though, in the discussion of a person's mental fitness. I think that if somebody were younger, there wouldn't, and was showing changes in behavior or cognitive skills, we wouldn't talk about dementia. We would probably talk about something else. Probably substance use, actually, would be what would be brought up. But, you know, just because someone is older, it's true, cognitive impairment is more likely in an older age group as compared to a younger one. But, you know, bringing it up and pointing to the person's age, I think that is ageist. And I think there are a lot of other things that an older person could bring to a position like being a president that would make an older person good for that job. So I do think it's ageist, and I think it reinforces stereotypes that older people should get out of the way, that they shouldn't be in roles that are important, that they don't have what it takes, that they're weak and frail, and I don't think that's very positive. So I think if we're going to speculate about what someone says, we should speculate about the content and not jump to a judgment or try to explain it in the context of some kind of a health issue. If somebody shares some of their health information, then there could be a discussion about how that is going to affect their performance in a job. But before that, I think it's ageist, and I understand where it's coming from, but I don't think it's appropriate. I don't think it's kind, and I think it does a disservice to other older adults who may be in highly responsible positions in a higher age group. And it reinforces ageist stereotypes. Tell me what you think. Do you think Joe Biden has dementia? Do you think Donald Trump does? Do you think that's relevant? And what are you basing that on? What about cognitive screening tests? Do you think that that's information that the public has a right to know? And do you think that the public really knows what to do with that information? Let me know in the comments below. And thanks so much for watching today. You can catch me at thewrinkle.ca or stay here on YouTube and watch the video that's being suggested right now.